Good afternoon, and thank you all for coming. For some of you, I'm happier to see you than you probably realize. For others of you, you probably have my enthusiasm level pegged pretty accurately. It's always good, though, to be with Dr. Dobbs and Director McCraney. One of the few upsides of this pandemic has been getting to learn from professionals that know what they do, and I value their service. I also value the service to the state of Mississippi of their teams and to others that are working hard during this pandemic. We are here to give you an update on the facts. I trust all Mississippians to make good decisions. But to make good decisions, we have to have the facts. The facts are as follows. According to the Department of Health's data, Mississippi has 1,633 patients in hospitals battling COVID today and 486 in ICU beds. Both of those numbers now exceed the largest number we've had during the pandemic. In addition to that, both of these numbers are increasing with the presence of the Delta variant, but there's another statistic that we must all consider. In the last month, 89% of our hospitalizations and 87% of our deaths have occurred amongst the unvaccinated. We have had approximately 1.35 million Mississippians get at least their first dose, and our total hospitalizations amongst vaccinated Mississippians has been in the 150 range. Let me say that again, almost 1.35 million Mississippians have gotten at least their first shot. Only a couple hundred of those have been vaccinated. I've always told you that I'd be honest to you, and there are some mild side effects to the vaccine, and we should be willing to talk about them openly, but they have been proven time and again to be mild. And statistics show that they are very effective at preventing serious disease, and they are very effective at preventing death. No single county in our state has a majority of its population fully vaccinated at this point. 16 counties are over 40% fully vaccinated. Last week, we administered 71,135 doses of the vaccine. This is the highest total that we have vaccinated since April, and it is a 256% increase over our lowest week in early July. In the first 3 days of this week, we have administered almost 41,000 doses, approximately 25,000 of which were first doses. And if this pace continues over the next 4 days, we will finish somewhere between 80 and 90,000 doses being administered this week. All told, 2.4 million doses have been administered in our state. 1.35 million, as I mentioned earlier, have received at least the first dose. Just 100 or so shy of 1.1 million Mississippians are fully vaccinated. So some 46% of our population has received at least one dose, and some 37+% of our population has received a full doses. Now, getting the vaccine is your choice. It is your decision. And as your governor, I will always defend your right to make that decision, and I will respect your decision. As I mentioned the numbers earlier, however, more and more Mississippians are concluding that getting vaccinated is a good choice not only for themselves, but for the people around them. If you are not vaccinated yet, I hope you will talk to your doctor I hope you will study the statistics, and I hope you will make your decision based upon the facts. If you choose to not be vaccinated, there are other choices that you should consider to protect yourself and to protect the people you love. As we saw over the last year and a half, social distancing and masking and avoiding unnecessary indoor crowds have all proven to help. And they're all things you can decide to do on your own. I would like to take just a moment and talk about that idea of responsibility. I believe you, as an individual Mississippian, can be trusted to make good and responsible decisions. Good practices are a choice. Staying healthy is a choice. Keeping your neighbors and your coworkers healthy is a choice. Now let's all make the right choices. Last Friday, I provided you with an update on what we've been doing to bring additional resources to aid our hospital system. I will provide you with another update today. The Mississippi Emergency Management Agency and the Mississippi State Department of Health has been carefully and thoroughly reviewing the 19 bids they received last Friday. So far, they have processed 57 clinical staffing task orders for hospitals around the state. The staffing companies are currently providing lists of their staff to both MEMA as well as the Department of Health for licensing, for medical licensing in our state. After the licensing process is complete, MEMA will coordinate the deployment of these additional resources to our hospitals. The goal is to have the staff arriving sometime early next week, if not sooner. Last Friday, I mentioned to you that MEMA had requested 150 additional ventilators from the national stockpile. I'm happy to announce today that the state has received all 150 of them. Components of Mississippi Med 1, a Mississippi field hospital, has been deployed to UMC to assist in decompressing their emergency room. A 20-bed unit has been established and is being staffed by 39 National Disaster Medical System disaster medical team members. In addition, a 7-person U.S. Public Health Service team is working at UMC to assist with the administration of monoclonal antibodies. There are really multiple paths one can take to avoid the hospital. One of those is to get vaccinated. If you were to get COVID, please talk to your doctor about the use of monoclonal antibodies. I know Dr. Dobbs will spend some time talking about that today. It is another way, if you test positive, to keep yourself out of the hospital. In addition, we are so thankful that Samaritan's Purse, 50-person team, has established operations at UMC to help with the statewide transfers within the system of care that we set up and are helping us decompress overly congested hospitals. This facility will consist of 32 beds, including 5 additional ICU beds. We asked for and received a 33-member National Disaster Medical Team, a DMAT team, as they are referred to, at North Mississippi Medical Center, assisting with their hospital decompression. We asked for and received 10 two-person federal teams to assist in the administration of monoclonal antibodies. These teams began work yesterday and are, in addition to the current resources in over 40 COVID centers of excellence providing monoclonal antibody treatment. Should you test positive, and particularly if you're vulnerable, but should you test positive, please talk to your doctor about monoclonal antibody treatment. In addition, the Mississippi Department of Health has expanded COVID testing sites in mobile locations. In Lowndes County, we moved to 5 days per week in the parking lot at the Lowndes County Health Department in Columbus. We have started testing again in Lincoln County in the parking lot of the Health Department in Brookhaven 2 days per week, and in Batesville in the parking lot of the Panola County Health Department 2 days per week. Due to high demand for testing and increasing traffic concerns, the Rankin County Health Department testing location has moved back to Trustmark Park and began operations today. Now, I would like to move to the subject of schools. I think it's fair to say that we are all learning as we move through this pandemic. Much of the early stages, a lot of us didn't know what we didn't know. I know I certainly have learned from some of the really good and some of the not so good decisions that I have made, and I'm sure everyone watching today can say the same. One of the things our whole country learned is that it's vital that our kids are in school, doing in-person learning. Closing schools last year was a mistake that far too many states made. We've not been perfect in Mississippi, but I am proud we didn't make that mistake. Our kids, by and large, stayed in school all year last year, and our kids will never, ever give up the academic gains they made because they were in school. That is why my priority this year on schools is simple. Do whatever it takes to stay in person. That's one of the reasons that last week I extended our state of emergency. I wanted to enable our local school districts to have all the tools they need to keep their schools open. If they want to offer vaccines with parents' permission to those 12 and up, they can. If they want to do social distancing and rearrange class sizes to do it, they can. If they need to utilize masks, they can, and they have the ability to do so. I want every school open every day possible this year. And I am willing to give local governments every tool they need to do it. We simply cannot accept surrender on educating our kids. Now we know there will be outbreaks and there will be quarantines. This is the nature of a contagious airborne virus. As vaccinations increase and as local administrators adopt mitigation tactics that they know will work and be accepted in their areas, these quarantines will decrease. I am asking all Mississippians to join me in this effort to keep our schools open. That means you have to make good decisions to help slow transmission in your communities. More cases in the community will necessarily lead to more cases in our schools. And that will make keeping our kids in the classroom that much more difficult. We all know that our state has suffered in the past because of lower educational attainment than some other states. We all know that education is the key to our future. I believe that this is a value that almost every Mississippian shares. And now it is time to prove it. At this time, I'm going to turn it over to Dr. Dobbs and then to Director McCraney. Dr. Dobbs.
Thank you very much, Governor, and thank you for your discussion about the vaccines, it's such an important element of how we're going to get out of this. We know how effective it is at keeping folks out of the hospital and alive with their loved ones. The vast majority of cases, hospitalizations and deaths in Mississippi are in the unvaccinated, without a doubt. We were very fortunate to see over 71,000 vaccinations in Mississippi last week. That's fantastic. We've already seen over 40,000 reported this week, and we know there's a little bit of a reporting lag. So we're seeing pretty good responsiveness for vaccinations. People are recognizing how important that is to surviving not only COVID, but the Delta surge, which has been so destructive for the state of Mississippi. But one of the things I really want to talk about is our monoclonal antibodies that our partners are doing across the state. That's been a phenomenal resource. As you know, and the governor mentioned, we have 10 teams, federal teams, that are augmenting what's going on in the state of Mississippi, and they are located in Lauderdale County, DeSoto County, Jackson County, Bolivar, Claiborne, Forest, Pearl River County, Warren, Adams, and then we have one in Jackson. By and large, they were chosen in these locations to augment what our Center of Excellence program is offering. We have 45 centers of excellence, hospitals and other medical centers and health systems and clinics that are committed to giving antibodies to people in the general public, even if not in the practice, which has been a phenomenal resource. But in total, we have 179 locations in the state of Mississippi that are offering monoclonal antibodies. So if you get COVID, we want you to talk with your doctor about monoclonals. But not only that, starting now, we are adding a call center for monoclonal antibodies. So if you call the hotline at 1-877-978-6453, there will be an option for monoclonal antibody information about where you can go to get monoclonal antibodies. And in certain areas where we have special relationships, they will do a direct handoff with that center to make sure you have access to monoclonal antibodies. In addition, I think you all know that UMC started offering patient select sign up, where you can sign up for yourself online or by phone to come in and get antibodies without going to a doctor. I did sign a statewide executive order, standing order, so that practitioners, nurses, et cetera, can give monoclonal antibodies directly without having to go through a physician or provider first, to overcome barriers, whether it's time, effort, or people who don't have insurance. So we're trying to make that more and more available. And I'd like to just give one quick sort of a shout out. This is an example. This isn't, I'm not saying there are other wonderful people out there doing work, but I had an opportunity to visit with Highland Hospital in Pearl River County earlier this week. And Brian Maxey, the CEO there, has been very passionate about helping his community, like so many other folks in their communities. And they're one of the places where we have these federal teams supporting. Yesterday, they did over 500 COVID tests, and we have supplied them with additional rapid tests because they're doing so many. So we're here to augment what's going on locally. Of those 500 folks, they gave over 100 monoclonal antibody treatments to people who tested positive. They saved lives yesterday, and they will save lives going forward. But in addition, and I think this is a fantastic approach, people who tested negative and were appropriate, over 100 got the COVID vaccine at the same process. So this is the sort of innovation we're seeing at the ground level by local leaders, and we just want to really call out the wonderful work they're doing, encourage others to sort of, heed the call, stand up, help your community. And Mr. Maxey and other folks like him around the state, we thank you for what you're doing. This is what's going to get us through this pandemic, and obviously if they need our help, they'll get with us. That's all I have. Thank you, Governor, and thank you all.
All right, good afternoon. I just want to kind of expound on some of the things that the governor spoke about, as well as Dr. Dobbs. We're all in each other's lane, but we're all locked steady together, and we're moving forward. So out of those 57 requests that we've got from hospitals for staffing, we're currently working those. You're talking almost 1,100 personnel that'll be going out statewide, and we will make the mark of the first of next week. I'm very confident in that. We're finding that the licenses are very good. Department of Health is working very, very fast on confirming what we're seeing. But I think the most important thing is, well, what does this really do for the state of Mississippi? Well, I'll tell you what it does. 680 medical surge beds. That's a significant number. 680. ICU beds, 212 once we get these people in place. It will increase. So that's going to take some pressure off of the medical system in which it currently finds itself because of this pandemic. We've got 10% of those that have applied already. We've got 10% of the entire number that we need that are currently in the vetting process, and we're continuing to see calls now. I texted my staff just before we walked in here, and we're getting that from those vendors and working those as quickly as we can. The governor talked about the antibody teams that we continue to get from the federal government, and I continue to communicate with FEMA representative, Ms. Gracia Sheck, my counterpart for this entire region. And also, I have a twice-a-week call here lately with all the EM directors of the other state, and we're sharing tricks. We're sharing what are the trends that we're seeing. We're sharing equipment with each other, and we're doing transfers back and forth. If they need help, we were ready to go help Alabama when the hurricane came there. So we still have these other disasters that we're working as well that I want to expound on. And I've got a great staff. Continue to do great work back at the MEMA proper, the building, and we're currently out in the field, still doing river flooding, still doing the flooding in North Mississippi, and we still continue to handle those. We've worked hand in hand with another state agency, the Department of Education, to ensure, we started this about 4 months ago, to ensure that we had enough youth masks on hand, along with the Department of Health, what we looked at, and we've been distributing those. We've been getting hand sanitizers out to these schools. We've been stocking them over the summer months to get ready because we want schools to be open. We want the children to be able to be there as long as they can, because that's going to make a significant difference, I think, in the development later on. And emergency management is a part of that. We're part of the community. We're part of the overall response in the state. Governor, that's all I have at this time.
Thank you, Dr. Dobbs and Mac, for your effort. In a moment, we're going to take questions, and when that happens, I'm sure I'm probably going to get asked over and over why I'm not imposing a statewide mask mandate. Last Friday, I answered that question 7 times, but these same reporters will likely ask it again. I'd like to have a little bit of straight talk on this topic. There are those on the right who would like me to make masks and vaccines into a political battle. There are those on the left, including most of the reporters in this room, who really want to make political hay and grow their Twitter platform because I will not issue mandate after mandate after mandate. Let me be clear. I do not give a damn about any political agenda. This pandemic, much of which is a pandemic of the unvaccinated at this time, is before us. There will be plenty of time for politics, but this ain't it. My objective is to give Mississippians the facts, give them and their local officials the tools they need to make good decisions, and then trust them to love each other enough to do it. If you have questions on the facts, I'll be glad to try and answer them to the best of my ability. If you intend to use this press conference as a platform to grandstand or to get MSNBC clicking on your story, please do not expect me to help you do that. With that, I'll open the floor with questions. And I'm going to start with Bailey.
WMC from Minneapolis has a question.
Thank you.
Let's see. Okay, we'll go on to the next. David Mitchell from The Advocate has a question.
Hi, Governor. My name is David Mitchell. I'm a reporter for The Advocate newspaper in Baton Rouge, Louisiana. Can you hear me?
I can. Thank you for calling in.
Yeah, I'm interested in some of your statistics on your data page that show roughly 86% of the deaths in the last month have been among the unvaccinated, which means that like 15% are among the vaccinated. And I'm trying to understand a little bit what y'all think might be behind that number. Is it simply a function of spread? Is this maybe an indication of what Delta is doing when it kicks into full swing in a location, or is there some other reason for that percentage? And the reason I ask is nationally, the reporting has been that about 99% of deaths are among the unvaccinated. So that difference is a lot larger than what has been reported elsewhere.
Right. I believe, and I'm trying to make sure I get this number exactly right, I believe that the number is 89% of our hospitalizations and 87% of our deaths have occurred amongst the unvaccinated. The 87% number is what you're asking about, and I'm going to let Dr. Dobbs speak to it. He and I have had this conversation repeatedly over the last week or two, and I think a big portion of what you're going to, of what he's going to say is, while the total number of deaths are sadly growing each day, the number of deaths during the month of July is a relatively small number, and so the 11% number in terms of absolute cases is a relatively small number. And I think, without getting into specifics on any individual, I think what you're going to find is that these are individuals that tended to be much older and much more immunocompromised. But I'm going to let Dr. Dobbs speak to that.
No, the governor's precisely correct. The folks who are vaccinated, who are not making it, sadly, are primarily people who are older, people who have weaker immune systems, and it's also a group of people who are mostly vaccinated. So if you look, if you consider the statistical likelihood, 75% or so of folks 65 and older are vaccinated, and so, but still, the majority of folks in those age groups who are dying are unvaccinated. But because this is an older age group, we know that their responsiveness to the vaccine is not quite as robust. And if we look at those who have died, the median age is 78, so it's a far older group. And not that it's not some younger folks too, but primarily older, and 54% have serious underlying conditions that weakens their immune system. And if you've been watching over the past few weeks, that's one of the reasons why we've been pushing so hard on the booster doses, on the third doses for immunocompromised folks. And so we're very happy and excited to be able to start extending that more and more to this vulnerable part of the population.
I also wanted to just speak towards a few more statistics that I think will be helpful in this regard. If you look at fully vaccinated individuals below the age of 40, there are not very many individuals in hospitals across Mississippi. If you look at fully vaccinated individuals over the age of 40, there are some, but not many, that are in the hospitals in Mississippi. If you look at not vaccinated or only partially vaccinated on the State Department of Health's website, they are showing somewhere in the neighborhood of 300-ish that are not vaccinated under the age of 40 that are in the hospital, and then the remaining ones, again, tend to be older Mississippians that are not vaccinated. There is a stark contrast amongst those over the age of 65 that are vaccinated as a percentage of the total population compared to those under the age of 40. And that's certainly playing a role in where we find ourselves. Bailey?
Sarah Ulmer from Real Politics has a question.
Okay.
Hey, Governor, thanks for taking my question. This is actually probably more for Dr. Dobbs. In the earliest waves of COVID, we talked a lot about comorbidities as being a primary driver of how someone could be impacted, but we've heard a little less about that with Delta. So kind of along the same lines as the previous question, is Delta less dependent on comorbidities to be lethal as compared to the earlier versions of COVID we were seeing?
So, I think we're still trying to figure that out. I mean, if you talk to the docs, they're telling you this is different. And I talk to one every night who's my wife, who runs an ICU. It's really hitting younger folks, in a way that we didn't see before. It's hard to know if it's a proportionality because there's just so many folks with it. But they're not seeing hardly anybody in the hospital or in the ICU from the nursing home. In large measure, we think it's because they're vaccinated and immune. But, they're losing a lot of people in their 30s and 40s and 50s. Now, are some of them a little bit overweight? Yeah, I think a lot, but most of Mississippi is a little bit overweight, right? 60% of Mississippi is technically overweight. So that's pretty common, but we're seeing a lot more sort of healthier folks. We're not entirely clear if it's a proportionality issue based on the number of folks who are getting it, because there's a lot of COVID out there. There's no doubt about it. But the severity is very much in contrast to what we saw before, and we're still looking at our statistics to know. I mean, nationally, we haven't seen that, and I've been talking to CDC, but, we're still early in the Delta surge, and we're kind of a little bit at the front edge of it a little bit, so we might be seeing things before it's realized across the rest of the country.
Yeah, the only thing I would add to that is when you think about the Delta variant and when you ask the question, is it different? Just keep in mind that where we find ourselves with the Delta variant, certainly in terms of Mississippi, is we're in about week 4 or week 5 of significant increases in transmission, and really the last 10 days has been the most of it. And so imagine asking that question about COVID in, say, early April of 2020, and the reality is I don't know that there's enough data to definitely verify that, but it is clearly having more impact on those under the age of 50, and at least one reason for that is the lower percentage of Mississippians that are vaccinated under the age of 50, and as to whether or not it is also more lethal or it's clearly more transmissible, is clearly, in my view, it is clearly more likely to be passed from one person to the next than the original COVID. But I think we've got there's a lot of unanswered questions with that, to say the least. Yes, sir.
This is for Dr. Dobbs. You've made mention early on that older folks, people that have situations, obesity, diabetes, whatever, that have already been properly vaccinated should go ahead and get the booster shot prior to the CDC actually jumping in there and pushing it in the last few days. The CDC is saying that sometime in mid-September it should be available to everybody. However, you have open vaccinations at different locations like Jackson State tomorrow through Walgreens, I believe, are going to be doing vaccinations for the community. Should adults that have received their 2 vaccinations and are in those situations where they have overlying conditions, should they go ahead and get vaccinated now rather than wait until mid-September?
Yeah, no, that's a really good question. And there were 2 things in there, right? It was mid-September, but it's also 8 months. So it's been 8 months since I got my first vaccine, right? So the 8th month is going to come a lot earlier for folks than mid-September. So we're still in conversations to trying to get the feel for that. We do have pretty clear guidance on the immunocompromised. I think the data is very strong. FDA and CDC have both given full clearance. We have previously given guidance that physicians need to have a one-on-one conversation. What I would say is that normal healthy folks who've had vaccinated probably don't need to get a booster. But if you do have severe underlying medical issues and you might have resulting immunosuppression because of that compilation of different factors, just encourage you to talk to your doctor right now, because it's not clear cut on who meets those criteria.
Question for Dr. Dobbs as well. So speaking of wanting kids to stay in school, we're coming up on football season, and that's going to mean a lot of pep rallies. A lot of them will be inside in gymnasiums. What is your advice to schools for events like this? Do it outdoors. I mean, you can't do a big event indoors without masks on, and even with masks on, that's no guarantee. Outdoors is such a much a safer option. We've seen things like when we had the state fair, which made us a little bit nervous. We didn't see a lot out of it because it's all outdoors. We've seen this over and over again. I'm not saying there's zero risk, and we have seen some person-to-person transmission, but we haven't seen these super spreader events. So we're really trying to get folks to do it outdoors. I mean, that's just the answer. You just don't need to do any indoor mass gathering where you're sharing people's air.
Yes, ma'am.
This is a question for you, Governor. Last week, when you were talking about schools, you said that for some kids, COVID is just the sniffles. And I know that that's not necessarily true, because we saw Michaela Robinson in Smith County who passed away from COVID just days after you said that. what do you have to say to grieving students or parents, people who are now scared? You just said a minute ago that that's the consequences of an airborne virus.
Yeah, with respect to the young kid in Smith County, let's just be perfectly honest. Every single death in this pandemic is hard to take. It's hard to deal with, and this particular one with a young lady that has her entire life before her. As someone who is a dad of 3 young girls, I know how hard this is on her family, and I pray for them every single day. It's hard for me to even fathom what they are going through, and the reality is that we pray for them, and we really hope God looks over not only the family who's certainly struggling, but the entire community. I mean, if you read the comments by the people who knew her and how much they loved her, you can't help but recognize what a good kid she was, and so the whole community is struggling with that. And it breaks my heart, as I know it breaks the heart of so many Mississippians, and that's why I think we've got to pray for her.
And bouncing off of that question too, you also said you're going to do everything in your power to keep schools open, but what are you going to do? A lot of kids, if they do choose to go virtual, like in Smith County, they don't have the options to have Wi-Fi when they're at home. They might have to have printed out packets or things like that. They do lose that education. But what are you going to do to keep the schools open? And for the schools who have had to shut down, like Smith County, what happens?
Well, I'm hopeful that in that particular instance, that the school that has shut down, that has been quarantined, or the classrooms that have been quarantined, or the kids that have been quarantined, I'm hopeful that it occurs for a short period of time. And I'm hopeful that as we potentially see transmission decline, that we get kids back in the classroom. We certainly have those individual kids in individual classrooms and some individual schools that are quarantined right now. But the vast majority of kids around Mississippi are in the classroom and learning. And so you mentioned the challenges with those individual kids that have a more difficult time. It is the reason that I signed legislation last year which made Mississippi the first state in the nation to have some 390,000 devices handed out to our kids in the classroom. 320,000 of those were purchased, all of which was purchased with federal dollars, 320,000 of which were purchased through our state contract, some 70,000 of which were purchased at the local level. And so that's certainly a big step in the right direction, that individual devices are available for every kid across Mississippi. Now, there are some kids that are in a scenario in which their Wi-Fi may not be as fast as it needs to be, and in some instances they don't have it. And the reality is we've just got to keep working, and as we have been doing, at finding solutions to that. Yes, sir.
Governor, earlier this week, a healthcare leader in Mississippi said that Mississippians as a whole have failed to unify to a common message and goal under the pandemic to prevent transmission. What do you think could be done to help bring Mississippians from across the aisles together to have a unified plan to get through the pandemic?
Well, I don't think that's unique to Mississippians. I mean, you know, where we find ourselves in the midst of the Delta variant. You know, the Delta variant really got very hot probably 6 or 7 or 8 weeks ago. It sort of started, it seemed like, in Missouri. you first started seeing very high case numbers and high hospitalizations in Missouri. Then it was Arkansas. Then it was Louisiana. Now it's Mississippi. But the reality is, if you go, as I often do, and look at the statistics in other states, it's pretty clear and evident that even in those states that have slightly higher vaccination rates, the Delta variant is raging. And let me just give you a few numbers. In Florida, their 77-day average is 21,342 cases per day. In Tennessee, 4,400 cases per day. In Arkansas, 3,549 cases per day. In Louisiana, 5,550 cases per day. I'm sorry, 5,550 cases today. Arkansas, that 3,549 was the number today. In Kentucky, a state that hasn't seen significant, certainly hadn't gotten significant national attention, a state near our size, 2,785 cases on a 7-day average. State of Alabama, 3,437 cases on a 7-day average. Our 7-day average as of day before yesterday was 3,394. Clearly we've had some fairly large number, had a very large number today. I mention that simply to say that for those of you who want to decide that this is only a Mississippi problem and only a Mississippi challenge, well, the numbers just don't bear that out. The Delta variant is extremely contagious. It is spreading throughout the Southeast. And of those 6 or 7 states that I read, they got Republican governors, they got Democrat governors. This virus doesn't really care what your political views are. It does seem to care if you have the vaccine or not, as based upon the number of hospitalizations and the number of fatalities amongst those that are vaccinated. Yes, well, I'll come back to you.
You or Director McCraney might want to answer this question. Of those 1,100 healthcare workers that have been requested to be provided by those private companies, how many will be hitting the ground next week? Will it be a chunk of that group, more to follow? You know.
Yeah, the methodology, what we're doing is we have a Tier 1 hospital, that's UMMC, right here in Jackson. Then you got Tier 2s and Tier 3. Now, all the locations, 57, are located, and it's a great scattering effect of where those hospitals are. So almost every community is going to have something within their jurisdictions to be able to handle that. So when those first, I've got 57 separate task orders. That's kind of the way we broke that out. It's 57 requests. So I know I need X amount of doctors, X amount of nurse practitioners, X amount of respiratory therapists, et cetera. And as we're getting those validated workers in, they go to start filling those requests. And that's the way we're knocking them off to be able to chink away from the problem. So they're, as soon as they're vetted, and a lot of the companies are telling me 24, 48 hours. From the second we say go, they're going to be here. So you develop those teams. Hospital needs to have a team that comes into place and be able to develop those open beds. Is that good? Thank you.
Yes, sir.
Governor, forgive me if you've answered this before. Do you plan to convene a special session to allow the legislature to allocate the state's $1.8 billion in federal emergency money for healthcare workers, and why or why not?
I don't have any plans for a special session at this time. I'm certainly open to looking to any options. You know, Mississippi. When you think about where we are, the reality is that before we had COVID, let's say in January and February of 2020, and even having served in the capacity of Lieutenant Governor of Mississippi, I don't think very many Mississippians fully appreciate the fact that particularly on emergency rooms and ICU beds, how little room there was even pre-COVID. When you think about throughout most of COVID, there's been 30 or 40 patients in ICU beds at UMMC, and even when in early July those numbers came down below 10, they still didn't have any ICU bed capacity. And so I think long-term, we're going to have a real conversation about our hospital system and where they are investing their money in things such as that. So that's dating back to January, February before COVID. Well, during COVID or over the last 6 months to a year, I am being advised that those hospitals that were already stretched thin before COVID ever occurred in terms of staffing have lost some 2,000 nurses. And so when you talk about what are the challenges that Mississippi faces now, everybody likes to write that we are facing a shortage of hospital beds. Well, that's not really accurate. We're facing a shortage of healthcare workers to staff beds that are available in hospitals throughout the state. I know there's been. Let me finish and I'll come back to you. And so we have over the last week or so seen 2 hospitals open in tents. And there's been a lot of press conferences surrounding those opening of those tents. And that's clearly the easiest and quickest way to get federal help here. But the fact is, it's not a lack of beds. It is a lack of staff. And that's the reason we've gone through the process of working with MEMA and the State Department of Health, identifying, working with the hospitals. It was some 75, I believe that's down to 57 at this time, telling us exactly what their staffing needs are, and then us going out and hiring those staff. Of course, those are Stafford Act eligible expenses. We do anticipate the federal government will pay 100% of them, but the costs are going to be significant on a weekly basis, significant. And just, I want everybody to understand, I mentioned on Friday that we had an RFP in which 19 different companies replied. This isn't necessarily going to be exactly like your normal procurement process in which there's 19 bidders and you go pick one, because in a lot of instances, none of the bidders are going to go out and be able to provide us 1,100 people from all over the country to get here in 24 hours. And so we're having to navigate our way through. And so multiple vendors have been selected by the team, I think is a joint team of MEMA and Department of Health, to provide different services. So for example, if there's X number of doctors that are needed, there may be one vendor that is going to provide those doctors. If there's X number of CRNAs, then one vendor may provide those. And so we're going to have to piecemeal it together because we certainly aren't typically in the business of staffing hospitals, but we are in the business of emergency management. And if it's a matter of getting it done or not getting it done, we're going to try to get it done. You had follow-up
question?
Sure.
My understanding of a lot of Republican governors' concern about expanding Medicaid in their states was the state match to Medicaid expansion. My understanding is that the Biden administration is saying we'll cover the match for 2 years, and the State Hospital Association is saying we'll tax ourselves, we'll assess a fee on people who go to hospitals. The state government doesn't have to worry about the match. So given those two sort of guarantees, why do you continue to oppose the expansion of Medicaid in Mississippi?
Well, I don't think it's correct to characterize the proposals by the Biden administration as the state never having to worry about the state match. Yes, they have, through the emergency bill that passed, extended the percentage that they will pay for 2 years. You haven't had the opportunity that some of these other reporters in the room have had over the last 3 or 4 years, but I'll say it for your benefit. I'm opposed to Obamacare expansion in Mississippi, and I don't anticipate that's going to change. I don't believe that Medicaid expansion would have really has any relevance of much with respect to our current situation. In fact, you look at the state of Arkansas, they expanded Medicaid. They're dealing with some of the same challenges. You look at the state of Louisiana, they expanded Medicaid. They're dealing with some of the same challenges. And there are long-term implications to putting 300 to 350,000 Mississippians on Medicaid as well. But even in the short term, I don't see that having much effect on the challenges that we face. Certainly not in the short and intermediate term. Yes, sir.
Well, this might be a question for either you, Governor, or you, Director. You mentioned there's going to be a high weekly cost for this staffing. Could you give us a rough estimate of that? I know the federal government is expected to pay it back, but in the meanwhile.
Yeah, one of the first things we do in every disaster is, starts local, comes to the state. If I run out of resources, I go to the federal, or I do EMAC in from other states, sharing equipment. None of us are manned or funded to do these major disasters. I am cut my teeth on Katrina. Perfectly understand that there's a time where you do need assistance. So what we're looking at, the roundabout cost right now, very approximate, is just a little under $8 million a week. And you're looking at, we're looking at 60 days. Dr. Dobbs and I have talked about it, 8.5 weeks or so, and we can extend this even further after that. But there's tools that we have to be able to get the cash flow going and to be able to get this. So that's a significant number for those local hospitals, is it not? I mean, so that it takes coming all the way up to the state and then us to the federal government to be able to do that. So in a lot of these projects that are big in this nature, we do what we call as an expedited project. We write those things up. We get all of our expenses and everything up front to the federal government. This is what we're going to do. And they normally give us a 50% credit up front. So we're able to start operating, and then as those costs come in, we start submitting them back in on the backside. So we have that in the legislature and the governor as well. The disaster trust fund that we have, it's not a big one, but it has been able to keep us nimble, and other funds that we've been using. So we use those federal grants to do that. Okay.
And I'll just mention, if my Department of Finance and Administration Director were here, she would remind me to remind you that we do have the cash flow ability to cash flow that. As some of you know, the Democrat leader in the House sent a press release a week or so ago asking for the legislature to appropriate money to pay for this additional staffing. That's a fundamental misunderstanding of how natural disasters work, and particularly how the Stafford Act works. The Biden administration, typically we get reimbursed 75% of expenses. The Biden administration on this particular expenditure has said that they will pay 100% of it, and I certainly don't think we should use state resources when we can utilize the Stafford Act to pay for 100% of it. Yes, sir.
Mr. Governor, so you say that Mississippi is not unique in the challenges we're facing to prevent COVID-19 transmission.
Correct.
But are there any unique Mississippi solutions that we could enact to help slow transmission here?
Well, the thing that the tool that we have available that helps the most, it's not unique to Mississippi, but the tool we have available to help the most is that more Mississippians getting the vaccine. We're seeing that occurring. You look at the numbers, the 71,000 shots in arms that were done last week, on pace to do 80 to 90,000. Just as a reminder, 3 or 4 weeks ago, we did 18,000 in 1 week, maybe 5 weeks ago. But within the last 4 or 5 weeks, we bottomed out at 18,000 per week. That's after doing 125,000, 130,000 a week the first several weeks when we were really had our mass vac sites open and operating. But now we're back up to being on pace to maybe even doing, if the trend continues, 100,000 shots next week, which certainly would be the most in any week since March or so. Bailey?
Mary Perez from the Sun Herald has a question. Well, she did. Okay. Hunter Dawkins from the Gazebo Gazette has a question. Hunter?
Thank you, Governor. 2 questions, and both of these questions are for you or Dr. Dobbs, whichever. The first one is a question about the booster. Is there going to be any access online similar to the way the vaccines were posted when they came out? Then the second question would be for the schools that have issued mask mandates. The elementary schools specifically, where the kids can't get vaccine shots, is there any way, Dr. Dobbs, the health department can issue face masks, that they can be able to throw away if the kids have sniffles or something as such? Thank you for the questions.
I'll just mention on the second question, I'm sure you didn't hear him, but Director McCraney mentioned through our state stockpile, we've spent the last 3 months delivering a mask to schools, and clearly if they need any more, we'll make that happen. But we've been delivering masks to schools for the last several months throughout the entire summer. And I'll let Dr. Dobbs answer the first question.
Yes, sir. Thank you. Yeah, so we've been working with schools a lot to provide resources, masks that we're talking about. I think we have like 1.5 million still sitting around that we're ready to share out, so they can request those. We also, we have a program where we can do routine testing that we fund through our operation, indirectly through the feds, and also vaccine locations. So that's something we do, vaccine sites with our Adopt a School program. As far as the booster shots, and just, the booster shot is just, the terminology really is just an additional shot of either Pfizer or Moderna from before, will be available in the same way, by and large, that the vaccines are available for first and second time people receiving a dose. It will be, pharmacies are starting to provide it. I know, most chain pharmacies and small pharmacies are providing them for the appropriate folks. Doctors' offices, we are working on offering them through county health departments. That is not available yet. We're still knee-deep in doing first and second doses, but we will likely have an online option where you can sign up to get your additional doses through a similar mechanism as before through the web form. Thank you.
Is there a need, Dr. Dobbs or Governor, to reopen the those big facilities, or is there enough capacity now?
Right now, we've taken a lot of the federal we got a state contract with a vendor to do testing, and so we're expanding out on that. We've got a pretty robust network of vaccine distribution that's more distributive throughout, the different provider types. At this volume, it hasn't really been a stress, running at around, 70,000 doses a week. So, I haven't asked the governor for it. I don't know that we really need it. So I think, that'll continue to be a question, but I think we're doing okay.
Yeah, I think it'd be helpful just so everybody, just to put that question in perspective, Bobby. If you look at yesterday, we did 14,388 doses. Of those, 8,931 were first doses, and 5,457 were second doses. If you look at it by facility type, the total number of doses that we did yesterday of 14,388, the hospitals did 680, so about well less than 6%. The State Department of Health vaccination efforts, where they are offering vaccines within the county health departments, yesterday they did a little less than 350 total. Where we're seeing the vast majority of doses being done are in private clinics, which includes FQHCs and other areas around the state. And yesterday they did approximately 4,246, and then pharmacies, which includes CVS and Walgreens, which are not only the large pharmacies that are doing it in-house, but they're also obviously the vendors responsible for doing it at long-term care facilities. And they did a little over 9,123 doses yesterday. So well over around 70% of all shots in arms were done at pharmacies throughout the state yesterday. I don't know of any real constraints that they're having. We certainly will continue to monitor that, and if we found ourselves in a position, if we felt like we had the demand, we would figure out a way to get vaccination sites open. If we could do an extra 50,000 a day, we'd make that happen. I don't think we have the demand to do that yet, but it is encouraging that just under 9,000 Mississippians got their first dose yesterday. I think we're in day was it 565? Or I read Jim Craig's deal. We're well over day 550, and literally 9,000 or 0.3% of Mississippians got their first dose yesterday. At 80,000 or at 90,000 a week, that's 3% of all Mississippians getting a shot in 1 week. Obviously, we can move our numbers up very, very quickly if we can maintain that pace. Bailey?
WMC in Memphis, try this again.
Yes, ma'am.
I do want to go back to the topic of schools and kids in schools. Now, yesterday we saw from State Health Officer Dr. Thomas Dobbs, and even on the website, that there are...
He's right there.
Yeah, I know. That there are 20,000 students that are under quarantine. There's over 4,500 students that are out with COVID. We've seen deaths. We've seen kids contracting COVID. But what is it going to... Why are we keeping schools open? We're seeing child death. What is the reason that you want to keep schools open so badly?
The reason I want to keep schools open so badly is because when you look at what happened in other states last year, when you look at what happened in other states that shut down their schools, what I would submit to you is that while there are certainly risks with schools being open, there are also risks with schools not being open. Go and look at the mental health hotlines that occurred last year because kids were not in the classroom. Now, there are third graders in this state, not that many of them because we had schools open last year, but there are third graders in this state that weren't in a classroom last year. There are lots of third graders throughout the country that weren't in a classroom this year. For some individuals, those that are the higher achievers, you know, they're probably going to be okay. They're probably going to be able to overcome that. But for those who are going to struggle to make it anyway, if they spend an entire year out of the classroom, they are never going to make up their loss of academic progress. Never. And it's going to haunt them for the rest of their life. And that's going to be thousands and thousands and thousands and thousands of kids across America. And so why am I passionate about keeping kids in the classroom? Because I'm passionate to see kids learn. It breaks my heart every time there's a negative outcome. I hate it when kids test positive for COVID. I hate the fact that we have several thousand kids that have tested positive within the last couple of weeks. But this notion of if these kids were in the classroom or that every one of these kids that contracted COVID got it in the classroom is just not accurate. A lot of these kids had COVID when they came into the classroom because they're out in the community. There are those who would argue that if they aren't in the classroom and they don't have anything taking up their time, if they're at home or if they're in their community, well, maybe they're out indoors playing basketball with 50 of them sitting there watching it. The fact is there are risks associated with whatever we do. The one thing that we have learned about COVID is that generally speaking, structure helps. Structure in the classroom. In the classroom, we have the ability in many classrooms to socially distance, to keep kids sitting in their desk. They don't have to go into the cafeteria and sit by each other and eat. They can eat in their classroom or they can eat outdoors in many instances. There's a lot of different scenarios for that to occur. And I'm not, as governor, going to tell every single school and every single school district exactly what they can and what they cannot do to try to keep their kids safe. But I will say that keeping kids in the classroom is exceptionally important for their long-term academic growth and also for their long-term success in life. And the states who chose to keep kids out of school for a year and now are trying to decide for them not to go back, in my opinion, are making a huge mistake. I've been here over an hour. We appreciate everything and appreciate you being here. Obviously, if you have additional questions or follow-up, you can certainly reach out to Bailey or Corey, and we'll try to get back to you as soon as possible. So stay safe, Mississippi, and God bless.